Hello, in this video, I'm going to be talking about delaying breast cancer treatment. Is it okay to delay breast cancer treatment or skip a treatment? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, often in response to your comments or questions. I'd also love to invite you to go to Yerbba.com to get your personalized report. Your Yerbba report is created by taking your medical records after you give us permission, cross-referencing it with the latest medical evidence, and generating for you a summary of the things we know about your tumor, the treatments you've already had, and the options you might hear about when you go to the many types of doctors you might see during your breast cancer treatment and afterwards. It's not a static report. It's updated regularly as new things happen in your life. As you go through treatment, it's updated. So it's really flexible and dynamic. The other thing is you can become a premium Ask Yerbba member in which you can ask experts questions about your diagnosis and treatment options, as well as management of side effects, etc. There's no limit to the number of questions that you can ask. All right, let's talk about delaying or skipping treatment. In general, we recommend that you not. Just to be really clear and to the point, we recommend that you not delay treatment between surgery and chemotherapy if you're having chemotherapy, or chemotherapy and radiation, or between surgery and radiation. There are reasons in which you might actually be advised to delay, and I'll cover those in just a moment. Why do we not recommend that you skip treatments? Well, treatment for breast cancer relies on consistency. You may know from watching our videos on chemotherapy that in the curative setting, we tend to use 2 or 3 or even 4 drugs together. What we're trying to do is prevent resistance to treatment. And the more time cancer cells have between treatments, the more likely they are to become clever and evade treatment. So once chemotherapy starts, we try to stay on track. Same with radiation therapy. We really try to avoid delays with radiation and chemotherapy. There are a couple really important exceptions. I'll start with chemotherapy. If you are having extreme side effects, if your white cell counts are low, if you have mouth sores or other problems, overwhelming fatigue, it's really important that we let your body recover. Even if you don't feel back to being fit as a fiddle, and you probably won't, your body needs to recover. And it's actually the case that those kind of responsive delays or responsive dose reductions, and by that I mean responding to side effects or toxicity, your body is seeing a higher level of treatment. So it's not going to compromise your treatment. It's the way your body metabolizes and clears those drugs. And we really need to let your body restore itself before we hit your body. And again, it doesn't compromise your outcome. What we try to avoid are preventable delays. For example, somebody who has, I'm going to use a really trivial example just to make the point. If you have an appointment to get your nails done, skipping chemo for that reason is something we really try to avoid. But if you're having side effects, those cancer cells are beaten down just like you are. You are keeping, that drug is hanging around longer in your body than in many other people. So if your doctor recommends that you wait a week, or sometimes that might spread to 2 weeks, then that's advisable for medical reasons and your care won't be compromised. Now, in metastatic disease, in advanced disease, the purpose of treatment is, yes, to prolong life, but also to improve quality of life. So it's more common in metastatic disease that we'll take a break. Patients can even take 6 months of a break so that they can live the rest of their, all the other aspects of their life until it appears that the cancer needs to be treated again. So when the goal is cure, we kind of hammer the cells. When the goal is control and improving quality of life, it's a little bit more of a delicate balance, if that makes sense. If it doesn't, put a comment or question below. With radiation therapy, we know that skipping a whole week is associated with a higher risk of local recurrence. If, and now I'm turning to the toxicities of radiation therapy that would warrant a delay, if your skin is peeling, If early on in your treatment course, your skin is what we call sloughing off and it's very moist, you're going to have a hard time completing all your radiation therapy. We need to let you take that break. And again, your body is probably seeing a higher dose of radiation therapy so that we can try to complete the course of radiation. What happens? Maybe you're watching this and you're like, I didn't finish all my chemo or I didn't finish all my radiation therapy. That's okay. This is not on you. It's how your body responds, and we treat the whole person. Yes, we like to stay on schedule. Yes, we like to finish treatment, but the most important thing is to make sure you can get through this and that you're not permanently suffering the effects of treatment. So if that's happened to you, it's okay. You've done your part. Your treatment team has done your part. If we keep treating you through that toxicity, you're more likely to end up with long-term neuropathy or long-term problems to your skin, for example. I hope this has been helpful. I've covered a lot. Drop a comment or a question below. Don't forget to subscribe to our channel and to go to Yerbba.com for your personalized Yerbba report. Thank you for watching.